Thank you, Acting Speaker, and I speak today on the Drugs, Poisons and Controlled Substance Amendment Medication Administration in Residential Aged Care Bill 2025. Now, this is a bill that will seek to amend the 1981 Act to ensure that only registered nurses, enrolled nurses or other authorised health professionals such as doctors and pharmacists can administer drugs of dependence and Schedule 4, 8 and 9 medications in aged care, Schedule 4, 8 and 9 medications in aged care settings. So on the surface, this sounds like a step towards improving medication safety, and of course we all want that. We want our elderly to be safe, we want medications to be managed properly. Personal care attendants will no longer be allowed to administer these medications, and these include antibiotics. Now, some of these personal care attendants, who are often the locals in residential rural scenes like where I live in South West Coast, they know their patients by name, they understand their routines, they understand their needs and their personalities, and they really are the backbone of our aged care settings. So I want to take a minute to actually acknowledge the great work they do. I was around during the time where we transitioned to personal care attendants in aged care facilities because we recognise that it's a home environment, it's not a hospital setting. However, as has already been said, as we age, the complexities of our health actually can result in medications of many tablets. But I wanted to just take a minute to acknowledge that, it doesn't seem the best use of registered nurses and enrolled nurses' time to be administering Webster packs. Now, for those that don't understand what Webster pack is, you go to the chemist, under the instruction of the doctor who's prescribing the medication, puts the pills in the day and the time of the day so that they can just be administered by popping out the medication. Now, in an aged care facility, you often have people who can't, who don't remember where they are, dementia patients, so you can't leave medications laying around. So often the personal care attendant will just assist the patient or the client or the resident to pop the pills out, and that's something I don't think we should lose. Obviously, we're talking about antibiotics, and they can be put in these Webster packs by pharmacists and prescribed by doctors very adequately, and also things like Plexia, which is a S8, Section 8, Schedule 8, but can be given BD twice a day. I think some of these changes, whilst I understand the Royal Commission's findings and intent, we do not want to be tying up staff when it's not as necessary as it is when a patient is going through a change and needs something like an endone administered for pain or morphine when it's in a pump setting in palliative care, for example. Those are the things we do want the registered nurses freed up to be able to do. So I want to take a minute to just acknowledge the great work that the aged care facilities do in providing a home environment. And let's not forget the human cost. In Terang, of a town of 2,000 people, there's actually a real deficit of aged care beds, and there's actually no respite available, and this is as a result of the May Noonan facility and being sold and the aged care beds that we lost from Terang. Now, the nearest option is 25 kilometres away, and the government, when I spoke to them about the need in Terang last time, said, look, it's all sorted, we've been doing a great job, we've got beds in Cobden and Camperdown, which is quite a distance, and it's not recognising the realities that the families and the spouses don't do any business in those towns. So that's not where the community of interest is. Their community of interest is in Terang. So often family members are, saving the government millions of dollars by caring for their loved ones at home, but they need looking after as well. They deserve support and they deserve access to respite. So the government can assist this by giving Terang Hospital funding to provide respite beds and help the people in Terang. Now, just last week, one of my own family members in Terang had to move into aged care down in Cobden, and it's terribly traumatic for the family. And, the family that I'm talking about have been married for over 50 years. Now, to visit, it involves a treacherous journey on a poorly maintained road full of potholes. For an elderly person, as in the case of my family member, this seems cruel and actually almost irresponsible. But why shouldn't they have the right to be in the relationship they've been in and support each other in their older years? It's, I spoke to Eve, a community member from Terang last week, who begged me to tell the government that the effect this is having on her community is very significant. And she actually rightfully said it's a form of elder abuse to break up these homes and force people into these situations and not understand the country environment. So, health services in the southwest really do need funding, just like other parts of Victoria. For example, we have a lookout facility proposed for drug and alcohol rehabilitation, and the committee who sit with the Warrnambool Regional Alcohol and Drug Centre have been working with the government, doing everything they believe that the government have asked them to do to jump through every hoop over the last 8 years to be eligible to get funding. Yet last week, the Minister for Mental Health, Ingrid Stitt, last week, visited and said, she was proud of the collective push of the community for this proposed service. I felt it was really patronising. She actually said, "We're proud to support RAD and the work they're doing with their community and traditional owners to plan for the region's first residential rehabilitation centre." Now, as I say, this rehabilitation centre was shovel-ready 2.5, 3 years ago, and the government kept putting more obstacles in front or changing goalposts. It's really insulting, and then to have them give them $100,000, it's like me giving my child $5 as a reward, at 30 years of age. It was just such a minuscule amount of money which was supposed to go towards a feasibility study. Well, the reality is we don't need a feasibility study. It is quite clear the demand for drug and alcohol rehabilitation in South West Coast. It is now the only place without a funding commitment or a facility. And we've just had the record of overdoses of deaths in the South West Coast. We don't need another feasibility study. We don't need more people dying from overdose. We need all the hard work that the committee of the lookout have put in, recognised, and the facility being built. No games being played about where it can go and where it can't go. No games around more hoops, and no patronising words about how proud the government is of all the work that's been done. Just getting on and doing it. But back to the bill. I support medication safety, I support clinical oversight, but I don't support legislation that is rushed. And given in the bill briefing, we asked the question about what will happen in communities like mine where we just don't have the staff. Now, I sat on a perinatal inquiry in about 2017 where we identified that there will be a very large shortage of nurses and perhaps if the member for Frankston's awake, he might remember that we identified quite a few deficits that will happen in the future in the health needs. Now, this hasn't happened in the last few years. This has been going on for 10 years, and I'm not seeing the workforce planning. I hear from some of the members that there's, I recognise there's 600 nurses or 650 nurses that will be needed to fill this deficit, but this is something we're just not seeing addressed in South West Coast. I'm not seeing the incentives offered, and therefore continuity of care is very difficult in aged care facilities. Now, I've nursed in these facilities. My mum's in an aged care facility. My dad died in an aged care facility last year. So I have been very, very at the coalface for some time now, and they do a wonderful job under extraordinary circumstances. But having enough staff to be able to administer the medication when needed is one of the challenges. And I'm not sure if we've got a bill in front of us like we have now that doesn't have any answers to the questions we asked about what will happen if they can't actually meet the requirements of having the right ratio of staff or the right qualification of the staff. And they said, look, it was very ambiguous actually. They wouldn't actually fine people, but there could be a fine, and that fine could be up to $120,000. Now, does that the staff that are fined, or is that the facility that's fined? They said, well, we'll just put an educational focus on it. Well, what's the point of the legislation if there's no actual change that can be identified from the changes that are being made, which was really what we were told during the bill briefing. So, I don't support I do support this legislation because it's something that needs to happen, but it just doesn't have the consequences. It doesn't have the support. It needs to be considered that proper consultation with the sector to get an understanding of what they need, and backed by real workforce planning and investment, not just penalties and promises. That another example of this government trying to look like they're assessing issues or addressing issues, but with no real solutions that will work in the real world, and certainly not in South West Coast. So our aged care workers deserve better, our elderly residents deserve better, and our communities deserve better than a government just doing token gesture bills like the one we have here.
Member for Lavington.